Well, hello everyone. This is Dr. Mike Chu, a physical therapist. Today we've got a special guest. Her name is Dr. Donna Kim Murphy. We'll be back in a few seconds, okay?
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. Hello.
All right, we are back. We are streaming live in our Facebook pages and, of course, in our YouTube pages. So if you're watching live, comment live. Watching on a replay, comment replay. Again, for those people who are watching, if you need continuing education units, check out medbridge.com. Use the code alternative, and it gives you 40% discount. And I've been using it. We use their RTM. We use their home exercise program. All the, and then of course my CEU units too. I use it too. So, but without further ado, we got a special guest today. Her not special, I mean, she's very special to me, but she's been a mainstay in there. We used to do a weekly live webinar on it, but we kind of stopped. But I said, well, let's go ahead and talk to Dr. Donna again about the guide education. So she is a physician, she's a neurologist, and she's the founder of PrognosUS. So without further ado, let's go ahead and bring in Dr. Donna. Dr. Murphy, could you please tell us again who you are? Who are you? And reintroduce yourself to the group. And then what is the guide education that we're talking about today?
Sure. I am Donna Murphy. I'm a neurologist and a neuroscientist. I'm also a caregiver to support caregiver to multiple people in my family. And I wanted to share with folks a bit about a program that is fairly new that started about a year ago, but that we expect will be very impactful. We hope it will be to support caregivers of people living with dementia, as well as the people who have the diagnosis themselves. And I'm not sure, Mike, if you've discussed the guide model before, have you, or should I provide more background on it?
Yeah, go ahead. I mean, I've been reading on it, watching. Actually even applied for it. I just can't get approved. It's just so much requirement, and of course, I'm not a physician. I'm
Right.
just a physical therapist, and there are some limitations on my end too. So, could you please tell us again, explain to the people, and of course, what are the benefit of it? I read on it. There's so much stuff that a caregiver and a family with loved ones that has dementia will benefit from it.
hmm Yeah, so the program is meant to be comprehensive or holistic, right? And the support that it provides, understanding that in this disease, um, the person themselves with the diagnosis of dementia over time will lose the ability to function independently, and they're going to need more and more help. That's true for all of us as we age. But it is even more true in dementia. It is kind of accelerated that we have these needs in a lot of domains. And so, what this program does is that it provides everything from a comprehensive assessment of kind of the circumstances for the person living with disease as well as the person caring for them. That is of their health overall, that is of their mental health, that is of caregiver burden, even. Also, an assessment of health related social needs for the care dyad, they call it, which is this coupling of the care recipient, the person with the diagnosis, and the caregiver. Most of the time, this caregiver is a family member, but some of the time it is a friend, right? And then there are those individuals who actually don't have a close network of support where they can identify a person who will take on this kind of responsibility, in which case they can still actually elect to enroll in this model and still be provided with a lot of support for themselves. And then kind of a path to care in the absence of someone who's been identified as a primary caregiver. So, in the beginning, what the model does, and you have to understand also, I think, up front, that the model is not for everyone. There are many exclusions to the model. So, the model is for people with traditional Medicare or Part A, Part B Medicare, not Medicare Part C, which is also called Medicare Advantage. Medicare Advantage is a disqualifier. It's the main disqualifier, but I will name a few other exclusions as well. Hospice will disqualify you if you're already receiving hospice benefits. If you're in a program called the Program for All-Inclusive Care for the Elderly, or PACE, you're also disqualified. You do have to have an official diagnosis of dementia. So if you don't have a formal diagnosis, either the guide model participant has to offer you diagnosis, which not all of them do, or you'll have to get that diagnosis formally documented before you actually enroll into the program for non-medical supports, or care navigation, basically. And so, yeah, I was kind of disappointed to learn this, actually, that if you have a designation of mild cognitive impairment, which does not always progress with to dementia, but often it will over time, just because so many of the modifiable risk factors of this disease we don't address adequately. And so over time, we accumulate risk, and eventually many of these people with MCI or mild cognitive impairment will convert. Unfortunately, we cannot proactively put these people into the program to kind of learn about brain health, to do all of the things to prevent onset even of the disease, right? We have to wait until they've actually advanced to mild dementia or more severe, moderate or severe stages of dementia before they are eligible to enroll. So, given all of this, actually more than 50% of people do not qualify. Actually, for Medicare Advantage, at the moment, about 55% of people who are Medicare eligible elect Medicare Advantage instead of traditional Medicare because it's cheaper month to month. And we expect that number to grow to about 65%. So only 35% of the people who meet eligibility with those exclusions, and also you have to have meet residency requirements and work history requirements for Medicare. Once you have met those requirements, still it's going to be about in the next 5 to 10 years, only about 35% of the population that is going to be eligible. So that's a big problem. But let's start with the people who do actually have access to guide, and those are the people who have traditional original Medicare Part A, Part B Medicare. Those people will get this comprehensive assessment that I mentioned in the beginning. That includes actually a home visit that assesses the home environment and some of the things that you need addressed about that context to make it the safest place for your loved one to be, right? And the idea with this program is really to keep people in the home, in the community, and not in institutional care, which, by the way, I forgot to mention, that's another exclusion. If your loved one is already in a nursing home facility, for instance, or a memory care facility, they do not qualify for guide either. So apart from that comprehensive assessment, so you can tell from the beginning, they're really thinking holistically about the care dyad because they're assessing both. And the idea is that that comprehensive assessment will then inform a care plan for the care dyad about all of the health and non-medical, the medical and the non-medical needs of that person. Then there will be a care navigation role of the guide model participant, that they'll provide this role. And there will be coordination with the clinical person who's involved in the care of the individual with the disease. The clinical person should be someone who has actually dementia proficiency. They can be a primary care provider who has a lot of experience with older adults with cognitive decline. They can be a neurologist, a psychiatrist, a geriatrician, or a subspecialist within any of those: neurology, psychiatry, geriatrics. So any of those individuals can diagnose this disease. If you come into the program with an existing diagnosis, then that can be kind of what's the word for it? Inherited, I guess. And a clinician that's part of your guide model participant with whom you enroll, which is an organization that actually delivers all of these care delivery requirements. That's the guide model participant. They contract directly with the federal government. They can actually then, just kind of check the box that you do have a formal diagnosis. They may give you a test or two, or for your loved one to perform, just to kind of see where you're at in this moment as they enroll you for services. Then there's another possibility that you don't have a formal diagnosis, in which case some of the guide model participants can actually offer you a formal diagnosis through a virtual consultation, and others may say that you need to go get that before you can enroll into the program. You do have to be formally diagnosed with dementia. And then once you have that and you're approved by Medicare, for the services because you meet all of the eligibility requirements, then you'll have somebody in this care navigation role. This is not necessarily one individual who will be the care navigator. It may be many individuals and or organizations that are basically collectively managing that role. And that is to provide you with caregiver education and support that is 24/7. So whether that is by text chat or by hotline, that can be through asynchronous learning on a web-based platform, or it could be live, webinars. It can be through support groups, right? So there are many ways in which the participants in the program are delivering on the model, but those are just some examples. They also will make sure that you have a care plan in place and that you're episodically checking in on what that care plan is and what's actually happening with your journey with this disease, to update that as needed as you go. They do care coordination. They refer you to community-based services. And importantly, and I think this is the thing that actually attracts most people into the guide model, they provide for $2,500 a year of caregiver respite. The important thing
Wow.
to know, yeah. The important thing to know there, I don't know if you're aware, Mike, but that caregiver respite is not consumer directed. So that what that means is you cannot say, as the person receiving these services, as the caregiver, for instance, right? You cannot say, I like this home-based service agency. I would like to use my $2,500 towards them, or just give me the money and I'll use it however I like, right? No, you do not get direct cash aid to use however you like. You cannot necessarily select a particular provider of these services, whether they be home-based services or adult day services. Those are the primary means by which people get respite or relief in this way. It has to be actually subcontracted providers with the guide model participant with whom you enroll. So then our responsibility as people who are seeking these services for our loved ones, for ourselves, is to ask the guide model participant, who are you partnered with to deliver these services? Because that is important to me. I want to use this agency, or, I really don't want to use these guys, right? Like whatever your preferences are, you want to know that that guide model participant can accommodate, or they have something equivalent, right, that you can do your own due diligence on. But those are some important questions to ask. Some other things that have come up in conversations with our caregivers is what happens in dementia where you have people going in and off of hospice, right? In and out of hospice, because that's not uncommon. With dementia, you'll have acute, decline because they have an illness in the moment, or a pneumonia, or UTI, and it can look really bad to where a clinician might say, I can assign you, get you hospice services. But then, they may get better and then they come off of hospice services. But what happens with the guide model is the moment that you start receiving hospice benefits, you're going to actually be kicked out of guide at this time. And so then, you may then lose your hospice benefits because your loved one gets better. And then you have to re-enroll in guide all over again, which is a whole process, right? So that sounds super inconvenient, but this is a new model. And I think they're going to figure out soon that, they're going to need another path for that particular challenge, because it's, as I said, it's not uncommon that we have people with dementia who will come in and out of hospice benefits. Another question that has come up commonly is, I'm a long distance caregiver and my loved one lives in a different state. My plan is, as this disease advances, I'm going to move them in with me, or I'm going to move to them. I think often it's that they're going to move their loved one in with them, right? And so when that happens, that means, the person will be in a different geography. That new location may not be covered by the same model participant. So again, before you get enrolled in this, if that is really part of the plan, then you should ask, are you guys also covering this other geography? So that we don't have to worry about, like unenrolling with you all and then re-enrolling with someone else when they make that move, because this is, many hours of like investment of time in the beginning to even get enrolled. And so, ideally you're not having to do that multiple times. So I'll stop there for a moment just to see, like, if you have questions, Mike, if you think there are any other things that others might have questions about.
Well, I want to go back to the qualifiers, like what you mentioned. But before we keep on going, I said, "What is that? What is that sound?" And I just realized it's your earrings, clicking and
Oh,
clacking. I said, what
let
does
me
that
try to
sound?
move that.
You know, well, anyway, I'm like, huh, is there a timer? I was like, and analyze it. But anyway, I want to go back to the qualifier that you mentioned. So if you're watching, especially the Alzheimer's group, it's very important that you keep your Part B benefits, your A and B, because the Part C automatically disqualifies you. If you are in hospice, obviously, this automatically disqualifies you. If you are in a nursing home, it automatically disqualifies you. How about in an
Right.
assisted living, Dr. Murphy?
Yeah, that
Will they cover that?
yeah, I don't think that should disqualify you. It's more
Okay,
like
good because
long-term nursing
yeah,
home care.
yeah.
Yeah.
Assisted
Yeah.
living is more like still a home for them. Another question that I was thinking is that, or a recommendation for those people who are watching who wants to learn more about this guide, the model from CMS or from Medicare, is that you have to make sure to get your diagnosis as early as possible,
Mhm.
because if it's too late, you're already in hospice, you haven't used this benefit. So the early diagnosis is very important. Going to a neurologist, going to a point person that will help you with the diagnosis. And basically the word by itself, it's guide. The word guide itself, it's an acronym. And I'm going to go back and read the acronym of this. So the guide board itself means guiding an improved dementia experience. And this is an 8-year voluntary program to improve the dementia care for both you the caregiver, right, the unpaid caregivers, and of course the patient. And this is just the start, because it's evolving. And there are so much people involved in this, and it will eventually evolve, and this will be, it will be a big thing, that you need to be in it as early as now. If you have a loved one that has even as when I say low, starting like an MCI, mild cognitive impairment, as early as an MCI, because it will progress to a full-blown dementia, Alzheimer's, or whatever we want to call it. It will progress. I mean, most of the patients that we have starts with MCI, and it will progress and get worse and worse. And
Mhm.
the earlier you detect it, the earlier the diagnosis is, the better you can at least prevent it or minimize it from getting it worse. And this is where you come in. So keep and stay with your Medicare Part B, ladies and gentlemen. Um, Here's my another question, Dr. Murphy. So, who should they talk to? Do they need to talk to you, or to their local physician or a local neurologist? How does this work? I mean, can they,
Right.
for example, I'm here in Tennessee, you're there in Texas, right? Uh, how does I mean, should I reach out to a provider like you out of state, or can a local provider like my local PCP, do they know this or something like that?
Right. So the program started a little over a year ago, and still there are so many physicians who don't even know what it is. They're confused by the model. They don't know how to plug people in. I think they find it to be suspect. Some of them, um, some of them also, I think, are delivering some of the same non-medical services which they are billing for. And I think this is something that we have to be cautious of. I mean, the model participants are actually responsible for this, but if the patient is receiving these non-medical supports, right, these care navigation, caregiver education, and support services from the physician or the physician's practice, and the physician is billing codes that are overlapping with what guide provides, you cannot double bill. You can't double bill the services, so they have to be sure that there isn't anybody claiming to be doing the same thing for them. Just like the PACE program disqualifies you, where you might have overlapping services for the same population of people, they are not wanting you to double bill for the same services. So the way you would find out about this, at the moment, CMS has recently actually sent out a bunch of letters to people who are eligible, right? So people who are Medicare eligible. They may have also sent it out to people who have, for the moment, elected Medicare Advantage, because technically every year during open enrollment, they can switch to traditional Medicare, Part B, Part A Medicare. and original Medicare is also what they call it. So you can switch every October 15th through December 7th, right? So they may have also sent these letters out to them. I'm actually not 100% sure about that. But what it says is it introduces you to what the guide model is, right? Why it's important and helpful. And then it lists for your geography all of the guide model participants who are taking people to enroll them, right, into the program for support. So you can reach out to any of them just like as a self-referral. If you go to the guide website, right, so just Google Guide CMS, which stands for Center for Medicare and Medicaid Services. And you should see the link pop up like right up at the top. And if you click on that and you go to additional information, there is an Excel spreadsheet that has the most up-to-date list of guide model participants. I will tell you that over time, there has been a little bit of attrition, like some of those programs have fallen off that list. I don't know if it's been that they've been kicked out of the program. I don't know that it's been that they voluntarily left. I do know that speaking to some folks who are from guide model participant organizations, they're not even 100% sure that they will use that designation and offer the services through Guide because it's not clear that this will, how do I put this? That it is financially attractive to them to do so, right? So like they have to be motivated to actually offer the program. And if it is a whole bunch of extra work in terms of like integrating all of the services within their institution to be able to deliver on all of the care delivery requirements, and it's marginally more that they would receive in return for all of that extra work, some of them are not necessarily motivated to offer it at all, which is, I think, it's unfortunate because for the caregiver and for the family, I do think it makes a difference to offer $2,500 a year of caregiver respite, even if you're constrained. You don't get to choose whoever you want to deliver those services, but that's around, on average, 80 hours of service a year. Again, we could probably benefit from a lot more help than that, but some people can't afford anything at all, right? So I think it's worthwhile, but I think some institutions are finding it's just too difficult. And they may not offer it. And in that setting, I would look for a national provider. Honestly, you can also look at the local providers, but I think you can potentially get more flexibility with some of the national providers. We're partnered with an organization called Harmonic Health. They are national in 32 states. They expect to be in all 50 states by the end of 2026. So I would check with an organization like that. Make sure that whoever they have aligned in your community to deliver the home-based services or the adult day services, that you're okay with who their partners are. You could inquire, maybe they don't have a partner lined up in your community, right? Because this is new for everyone, and everybody is like cultivating new partnerships in order to offer this everywhere across the country. And so if they don't yet have identified partners, you might suggest to them like, hey, I really want to enroll with you, that I want my caregiver respite done through these agencies. And maybe they will then partner with those agencies. I think that's a possibility. But yeah, you want to ask them about this. The other thing that you really need to be careful about is that I have heard now that some of these guide model participants are requiring that you switch your clinicians. So if you already have a PCP or a specialist who's actually following you for your dementia and you really like them, the guide model participant with whom you enroll may potentially require that you switch. So, that is obviously easier for them because it's easier to coordinate care when everything is under the same roof, but it's not convenient for people who already like their physicians,
That's
right? And want to
true.
stick with them.
So it's
So,
basically
yeah.
I mean, just like being in hospice when you're transitioning from a palliative or restorative program, and then you switch to hospice, not automatically, but you lose your PCP, and then your provider now will be the hospice physician. So I get the concept. No wonder it's not materializing for physical therapy. It's really more for
Yeah.
PCPs and everything. So, but
Yeah.
it's a
And
good
so,
concept, right? I mean,
It is a very good concept. And like I said, not all of the participants, like Harmonic doesn't require that. They don't require that you switch your PCP. You get to stick with the provider that you want in terms of your clinical care. So they're then required to coordinate with them, right? And that's more complicated than if they had everyone under one roof. But for the moment, they're offering you the ability to stick with the person you've already identified as the person you want following your dementia care. So yeah, that's kind of how it works. I'm happy to talk to people at greater length about this. You can always reach out to us at prognosis.com. We will continue to update people on the guide model as it evolves because it is an innovative program out of CMS. It will evolve. The whole point of
mhm.
these programs is to figure out what is actually the ground truth by putting something out there, right? That smart people thought about for a long time, and they created something to offer, but they knew that it was going to have to be shaped by the realities on the ground. And so this is going to evolve. You should, plug into our free newsletter on our website to just follow along with what is offered as it evolves. You can reach out to us with any questions that you have about the model. You can always enroll through our partner Harmonic Health, and we can make those connections happen. So yeah.
So, how about in for example, in my situation, I have a lot of patients who, have dementia, Alzheimer's. Uh, do they just reach out to you? Because we don't. I looked it up. There's no guide here yet. We have a PACE program, but somewhere in Chattanooga, that PACE should be
Oh,
in every city. But no,
yeah.
we don't have it here because it is state funded, and it's so hard to get approved. And I tried to apply for it. We only have one here in Tennessee, which is in Chattanooga. And then, so with that being said, um, if I have a patient right now and
Right.
they don't have, they're not in hospice, they're just walking in here doing therapy, regular physical therapy, can they reach out to you? Can I refer them to you? Hey,
Yeah,
can
absolutely.
they do this and do that? And then you guide, obviously guide, that's the purpose of it. And
Right.
then really take care of them. And how does the billing work? I mean, do you bill it on your end, or Harmonica Healthcare does that?
Yeah, Harmonic Healthcare does all
Or
all of
Harmonic?
that.
Mhm.
I mean, so there's no billing for the person themselves. They actually, once they enroll, I don't think that the person themselves who's enrolled, they don't have to deal with any paperwork. It's all
Mhm.
done through Medicare, and it's free through Medicare. All of the care delivery requirements are delivered at no cost. There is no copay. There's nothing, including the $2,500 a year of caregiver respite. So that is done directly with the guide model participant, which is Harmonic. It's not us. Harmonic has the contract with CMS, and so with each person enrolled, every month they will receive an amount of money that has to do with how complex the patient is. And the complexity of a patient has to do with their dementia stage and also how burdened the caregiver is reporting they are through something like the Zaret burden survey or some standardized metric of like how much stress they have related to their caregiving. The other thing that makes a person more complex is if they have no identified caregiver. You can imagine that becomes a lot more complicated, especially as the disease evolves, if there's no point person except for the person themselves who's having cognitive difficulties, right? So the most reimbursement is for those people who are most complicated, but all of those financial things happen between the participant and the federal government. The person themselves are not involved in that, except to say that they're being assessed for the complexity as their disease evolves. But yeah, you don't have to worry as like kind of the end user about any bills or anything like that. Yeah,
Perfect. Well, I'm in their website right now. It's pretty nice and straight up. It says here, for every family navigating dementia, using powered by Medicare guide model. So I think I'm gonna try to refer some patients here, and then
yeah,
see what we can get from it. Because we need this support. And then
for
for those
sure.
people who are asking, or for those people, their website is harmonichealth.com. You can check it out. And are you one of the board there, or consultants there too, Dr. Murphy?
We're a subcontractor with Harmonic, and so we do all of the caregiver support and education. Um, In Texas, we're doing it. In several other states, we're doing it very explicitly with them. And then, kind of informally, we are covering any state where they are. We're making referrals that are coming to us. We have a bunch of caregivers who are either subscribers or they follow us in our newsletter or whatever. They're somehow in touch with us. They're part of our caregiving community. And so, any of those people who are qualified, we very highly encourage them to kind of go check this out. They are in Tennessee. They're, like I said, they're in 32 states right now, but that includes your state. We have, a partnership in place with a big a national, I'm not sure if I can say it here. It's a
Yeah.
national direct primary care program that is in multiple states. And they've decided that the simplest thing for their patients who have this disease and their caregivers is to actually refer them to us, because we offer support for caregivers, whether it's within the guide model or not, right? So there's so many people, like I said at the beginning, who are disqualified. So what they do is they send them to us when they have a diagnosis of dementia so that we can provide caregiver support. And we then assess, like, if you have traditional Medicare, hey, there's this program you can qualify for that is super comprehensive. We highly suggest you check this out. If you're okay with it, we'll share your contact information with our partner Harmonic and they'll reach out to you. If you don't qualify, we also have low-cost caregiver support at subscription. You can do that as well. And that's a part of what the guide model does. It's not all of what the guide model does. But we also offer direct aid, which the guide model does not offer, right? So they don't give you direct cash aid. And that is also something that is available through our subscription. So yeah, I think that's been simplest because they don't have to refer to multiple places, or they don't have to tell their patients or clients, oh, you don't qualify, so never mind. Right?
Hmm.
They just say, if you need caregiver support, and you do, if you are dealing with this disease, every caregiver needs caregiver support, we're going to send you over to Prognosis. Prognosis will then help you, get plugged in either through their low cost subscription, which will be available to you, or free through Medicare, through their partnership with Harmonic Health. Yeah.
Well, already signed up with Harmonic Health, and then says my submission has been received, so we'll figure it out.
Wonderful.
What they need from me and everything. But again, thank you very much, Dr. Murphy. Appreciate you. Any last parting wisdom for the caregivers out there who are really struggling? So
Yeah, I mean, all of our caregivers who are more advanced in this journey or who have already lost their loved ones, they 100% of the time say that they wish they had only known X, Y, or Z earlier in the journey. And so this is what has motivated us to build what we have built with caregivers, actually, and of course with caregivers in mind, right? And that is a community of people who you can relate to, who are there for you continuously, who are accessible culturally, and in terms of the language that you speak. Right now, we're covering Korean, Spanish, English, and like kind of provisionally in Chinese, and we'll hope to expand our language community coverage. So I really encourage people to plug in early. There is so much that people don't know about what this journey looks like. There is so much silent suffering. And a lot of that is emotional and social, as well as financial and physical. The suffering that we witness our loved ones actually go through, and the suffering that we experience as caregivers. And so, that doesn't have to be alone. It can be done in a community of people, which itself can be healing, supportive, and it really helps you get through a very difficult time. And it can be a really long time with this disease. So I highly encourage people plug in.
I like what you said about, not really like, but that's so true about the silent suffering. I mean, a lot of
Hmm.
caregivers out there is just so burned out, and they don't know what to do. And the first thing is very important, is you educate yourself about dementia, educate yourself on how to take care of your loved ones, educate yourself, in that way you can share this knowledge. Not just the knowledge is not just for us. The goal for us is to teach you and of course guide you, so you
Exactly.
could navigate this journey, because this is not like a one time education or experience where you had a surgery, tomorrow after 2 weeks you're better. No, this is a disease that will take years
Yep.
for to develop and happen, like 10, 20 years, because people have dementia. They live longer now because of all the advances in
Yeah.
medication. in medicine. So again, thank you very much, Dr. Murphy. Appreciate you. I hope we can do this more, and educate more people about this program, about prognosis, about
Of course.
what's that health again? That
Harmonic health. Yeah,
harmonic
our
health,
partner.
harmonic
Yeah,
health, and that
yeah,
way we can share more to the rest of the people who needs it. Again, thank you very much. But before I let you go,
absolutely.
ladies and gentlemen, always remember the word fast, FAST, letter F. Find people that will bring out the best in you, because you are the average of the five people you hang out with. Today, I hang out with Dr. Murphy. I feel like I want to learn more about this guide model. I've learned this like a year ago, 2 years ago when it was starting, but I totally forgot it. Focused on growing physical therapy. Next letter is letter A, take action. Uh, all this stuff what we're doing is not going to do me good. It's not even going to do Dr. Murphy good if you don't take action. Take action. Go to their website, prognosus.com. Is that correct, Dr. Murphy?
Hmm.
Reach out, subscribe to their newsletters and everything. Next letter is letter S. Share and subscribe. The more shares, the better. Share their website. It may not be applicable to you right now, but it could be applicable to someone else that needs help. And last but not the least is letter T, is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, just like what Dr. Don is doing, you're actually understanding it more. And that's how you get better. That's how you understand dementia. That's how you share it to other people. Again, thank you very much. Be awesome, be great, be excellent, and we'll see you in the next episode of our Jerry Hab Show.
HelloNote is a truly therapist-friendly practice management